Hi everybody, I'm Phil Fatica. Welcome once again to the government channel. We are Channel 9, and it's my pleasure to be with you and to introduce you to Gina Cloft. She is with the Erie Division of the American Heart Association, and I know everybody knows the American Heart Association and its mission, but there's so much to say about what it is that you do. And so you have the next hour and a half to just go ahead. First of all, are we getting smarter and better about taking care of ourselves and our heart, or are we still not eating what we should be eating, not exercising, just generally not waking up to how important it is until we get to be a little older, and then we start going, oh, maybe I should start doing this stuff now? That's a broad question, I know. So go ahead, take the ball and run with it.
Sure, it is a great question, and I think in some respects we're doing a better job.
Okay.
We're recognizing, that there is a disparity, that there are things that we can do to improve our overall health and wellness. But by the same token, the numbers, the statistics, the rise in juvenile diabetes, obesity, and certainly the
My notes say that it is the what of women?
Number one killer in the country, but certainly the number one killer of women. One out of every 3 women will die from heart disease over the age of 25.
Why is that?
There's a couple of reasons. The main reason being that women do not recognize the warning signs.
Which are?
The warning signs for women are not as typical for men. Now, sometimes women can experience the warning signs, the same symptoms, but oftentimes we're hearing from survivors that they had flu-like symptoms. They were fatigued, and that something just wasn't right with them. I've heard everything from diagnosis of having bronchitis to depression with women from family physicians. So I think that one thing that women can do, of course, is know their family history. Know their numbers, that's your blood pressure, cholesterol, weight, etc. And then most importantly, with women, we tend to take care of everyone but ourselves.
Yes.
So we want to take care of our husbands and our parents and our children, even the pets, the pet dog or cat sometimes.
You're a tough breed,
We are
Women are tough. Tougher
we
than
are
men.
tough, but we also are at risk. I mean, it is a very, very, very serious thing. And so with that, we want women to take control and to start recognizing the warning signs, to know their family history and know their numbers.
Good. And so the mission of the Erie Division of the American Heart Association, I know it's quite broad, but in not quite broad, so broad that you can't say it. What is the mission that you
Our mission
educate?
is to build healthier lives free from cardiovascular diseases and stroke. So of course, our research is critically important, the local education and programming, our wellness initiatives, as well as collaborating with our local partners, the hospitals, of course, our local corporate partners who are so critical in getting the messages out to the workforce. And then finally, the fundraising piece, that's so important to us to continue our great work.
Yeah, that's basically how you make your money, right?
It is. At the end of the day, I mean, corporate and private donations are significant, but the fundraisers that we do really help us achieve our overall goals.
I know it's hard for the audience to see, but you're wearing a red dress.
I have my red dress pin,
right there. Yeah. And what is that?
I wear that very proudly. That is our symbolism of women and heart disease, our initiative around creating awareness, raising awareness, and every year in February we have a special day. It's usually the first Friday in February. We ask everyone to wear red, and the men as well, because every man has a woman in his life that he loves, and we want people to recognize that it is a significant killer. Someone in this country dies every 37 seconds from some form of cardiovascular disease. So it's a devastating disease, and it's important for us to help the women identify their risk and take actions to prevent their early death.
And let's call this table the world. Are we pretty much near the top in the heart diseases as a developed nation and countries? There are many. In other words, we really don't take very good care of ourselves. That's what causes this. There are countries that are way below us that don't eat what we eat. They exercise more. They're not as stressed out. Their work schedules are not. Where do we rank in the world, I guess?
I mean, that's a great question, and I don't have the exact statistics. I will tell you, however, for what I've seen is that even though we have some of the best health care in the world, we oftentimes also have the highest prevalence of diseases, and that's because of our lifestyles.
Now, can you narrow that down, let's say, by states where we live, for example, northwestern Pennsylvania?
Extremely high risk of obesity, juvenile diabetes, and certainly our risk of dying from heart disease and stroke in Erie, Pennsylvania is significant.
And that is because of?
Our lifestyles. I mean, at the end of the day, we have controllable and non-controllable risk factors. And the controllable risk factors are the things that we can do something about. Our sedentary lifestyles, our diets, what we're smoking, our stress levels. So those things are important for us. But in Erie, we find that cardiovascular disease is a real issue. There's a lot of people working in a very sedentary environment, as well as not making the right decisions around what we're eating on a daily basis. So the fast food comes into play, and also just the general education, especially with our more diverse population. So we have a long ways to go. We've got a lot of work to do.
Wow. A lot of this requires volunteers.
Correct.
Here's your chance to make your pitch. How do you need them?
Oh my gosh.
How can they contact you?
We're so blessed.
What do they have to do? What special skills do they need? Et cetera, et cetera.
Anyone's welcome to join us as a volunteer. We have all different types of volunteers. We have leadership volunteers who are corporate executives in the community who have leverage and are able to help us do some outreach with their partners as well as their employees. We also have a lot of student volunteers who are more the hands-on, for events like our walk and the ball. And then just daily volunteers that could help us, do some outreach. There's advocacy, there's our youth markets program, of course, education. We have a great speakers bureau program, so we're always looking for people that are willing to go out and share their knowledge in the community to help us educate the public.
Speaking of educating the public, I'm sure our audience has noticed within the last couple of weeks or so, maybe 3, you have these ads running about calling 911 when hearts attack. That's brilliant. The first time I saw that, I went, wow. The guy is just getting the snot beat out of him, and nobody's doing anything about it. That's not a local ad, is it?
It is, absolutely. It is. It's something I'm so proud of.
You mean it's not playing nationally?
No, this is a pilot program being done here in Erie, Pennsylvania, the first ever of its type in this country. Our national center out of Dallas chose Erie specifically to pilot the program in. And there's a couple of reasons. First of all, it's because of the great partnerships that we have with our local media partners as well as our hospitals. But the most important reason was because of the geographic challenges that we have with our outlying areas like the Corries and the Girards Lake cities, Union cities. How do we get those patients quickly to the hospitals that have the best ability to treat, their STEMI heart attacks? So with that, this campaign will be a year long in Erie, Pennsylvania. We'll have a measurable result, and the idea behind the campaign is really to educate people. There are many different reasons people resist calling 911, but what is the significance behind that? Why is it so important?
Why don't they call?
We've heard it all. We actually did a survey. We've been working hard this past year to find out why people resist. And some of the big reasons are, of course, they're embarrassed to have an ambulance come into the neighborhood. They don't want the neighbors to be curious what's going on next door. The cost. And a lot of people think that, I'll just get in the car and drive myself. I'm having symptoms.
I know somebody who did that.
Big problem. Well, not only do you risk yourself, but you're risking the lives of innocent people who you may kill if you have a major incident on the way to the hospital. And unfortunately, in Erie, Pennsylvania, we've had that happen a few times. So we always want to encourage everyone to call 911. And the most important reason is a cardiac team. There's a messaging system, to break it down into layman's terms, that come from that ambulance the minute they get to your house and they know you're having a heart attack, immediately responding to the hospital, sharing with them that they've got to have a cardiac team on hand. critical minutes to save your life.
Absolutely.
If you drive yourself to the hospital, you go to the emergency room and you go through the ER process, which could literally add minutes, if not more, as we know, sometimes hours to the process, and ultimately could end up in your death or a longer recovery. So calling 911, you're getting the professionals to your house, you're getting to the hospital, and that cardiac team will be there immediately to assess your needs and get you right into the cath lab if necessary. It's really, really important, and our research has found that it could save 30,000 lives a year if more people call 911.
Yeah, it is. It's just gas. You know.
Right.
I'm okay.
Yeah. I don't want to make a big deal about it.
Yeah, it's all right. I'll be all right. Just let me lie down.
Right.
Something. That was great. I didn't know that was local.
Yeah,
Another
it's
question
really
here
exciting.
is, what about your Lunch and Learn program? A lot of people sitting out there going, well, okay, tell me some more about this.
Sure,
Gina
sure.
Clough from the Erie Division of the American Heart Association.
The Lunch and Learn program is something that we've done for years, and it's really a partnership with our local corporations where it's our give back. What we do is we have a great program where we have topics, about 20 different topics. So it's smoking cessation, managing your blood pressure, stress management, exercise, I could go on and on and on, diabetes and heart disease. And those corporations actually can choose to have us come in with a medical professional, usually a volunteer from our board of directors or another volunteer that is passionate about the cause. They come in and they share their knowledge to their employees, and then the corporation is encouraged to bring in some sort of a heart healthy lunch. And we're able to reach thousands of people every year with that program. It's completely free. There is no charge at all. And certainly something that I would like to see us expand to the general public in the future, but right now it is something that we do with our corporate partners.
Speaking of lunch, there is a movement afoot, not only in Erie, but I believe across the country, of making the lunches in schools more healthy. And there's a pushback against that too. At that age, they don't like some of that food. They initially will take it and then throw it away. They may get a couple of apples and an orange at lunch, but they go home and they have more pizza, more potato chips, more pop loaded with sugar, but at least there's a movement towards saying you have to eat more healthily, or healthier, and maybe this would be the first step toward doing that, do you think?
It is. I mean, the Heart Association's been passionate about this change with the school menus for years now. We have an advocacy group that works closely to make sure that we have legislation passed to make sure that happens. In the meantime, we have incentives in place for schools, and we're working with our local partners through our youth markets team to identify how we make it fun. Let's make it fun for children to make those smarter decisions every day. One big piece of that is our Teaching Gardens program. Our research has found that if a child grows and raises their own fruits and vegetables, they're more likely to eat them. And also helping children identify. It's frightening, but some children don't know that a chicken McNugget comes from a chicken or that French fries come from a potato. They don't understand the whole food. So we're really very, very serious about educating our children and incentivizing them to make healthier decisions.
What about young kids smoking? When I was growing up, I was 13 or 14. I started smoking because it was the cool thing to do. That's what you did. You smoked. Have you noticed that students today, younger students today, are they smoking less? Are they not smoking at all?
That is the one.
Girls and boys. Girls do just as much as guys.
That's the one area where we have a great bit of good news to share. There are trends are showing that our youth are smoking less than they've ever smoked before. I think one of our bigger challenges is to get some of our adults to stop smoking. However, there are incentives in place in schools, again, through our wonderful Youth Markets program, to educate children at a very young age about the devastating effects of smoking. And we partner and collaborate with our other local partners. The Erie County Department of Health, of course, is one of them, to help make sure that we're teaching them at a very, very young age that this is a habit that they do not want to pick up.
Now let me go to the component of that is drinking. A lot of binge drinking going on in college. Part of the ritual initiation of going to school is how much can you drink before you pass out. Do you find that drinking leads to heart problems? Obviously, cirrhosis of the liver, perhaps.
Sure.
But is that a component of the American Heart Association's mission?
The part of our mission, of course, is to always make sure that we have a holistic approach to our health. We don't focus so much on the binge drinking. We have released some information about, a glass of wine perhaps being heart healthy for our adults. We do not, unfortunately, focus a lot of our energies on the binge drinking piece of it. Yeah. We focus more on the diet, the exercise, and of course the to not smoke ever.
Now you have a new initiative, I understand. It's called My Heart, My Life. It's a powerful tool called My Life Check.
That's right.
What's that?
My Heart, My Life is a year-round program that we partner with our local corporate partners. It's really fantastic, and basically what it does, it has a series of educational components. It's kind of like a package, and within that package is umbrellaed a wonderful My Life Check program. It's an online assessment, completely confidential, that anyone can take completely free. They go online, it takes them 3 minutes to answer a series of questions, and at the end of the questions they receive a heart score. So on the scale of 1 to 10, you receive a score from us.
I don't want to know my score.
No, everyone should know their score, Phil. Remember, know your numbers.
Nah, I don't want to know.
But we want to encourage people.
I'm in good shape.
Great.
I don't smoke.
Great, good.
I eat well, I exercise.
Wonderful. And see your physician on a regular basis.
I see that too.
But so what we want to do is we want to, with this, of course, give them a heart score, encourage them to increase their score each year they take it, and then give them some tools and resources to increase their heart score. For example, are they consuming enough fruits and vegetables, enough fish, getting enough moderate physical activity in there? And a lot of people, it's just that they didn't know. Of course, they have to be completely honest to get an accurate score, but it is a wonderful program, and we've been able to roll that out to about 3,000 people in the community since we initiated the program.
Yeah. Sometimes it's slow to catch on, but don't give up.
Never.
Not too long ago, I interviewed Jordan Kaleo, Miss Pennsylvania from Erie, from Millcreek, and she is pretty much inclined toward going into something in a health field, I would think. I'm not exactly sure, but cardiovascular disease seemed to be attracted to her. And I'd like to think that, isn't that great that somebody of her age is already kind of got on the radar screen there. In your travels, again, going back to the younger people, are they starting to recognize what it is that they can do differently than, say, their grandparents did? Or I'm not even sure, maybe their parents. I'm not sure.
I mean, I think we're seeing some better visionaries in our children. For example, the smoking, the trends with the smoking. But again, have a long way to go. We're proud to have someone like Jordan partnering with us to help, get into those important, populations with our youth to say, here's a young, beautiful, physically fit person who takes it very seriously, and that it isn't always an older person's disease.
She's an exercise hound.
She is. Yeah. She's incredible.
You don't want to go up against her in the gym.
She's been working with us in the community as a spokesperson, helping us raise awareness, and certainly going into the schools, because the kids look up to her, the younger children.
Sure.
They aspire to be the beauty queen someday. So it's a really good partner. That's right. That's a really good partnership for us, and we're proud of that.
Let's take what we're doing right now, the media. For the longest time now, cigarette smoking has been banned on television. And I think, and even music videos, it's kind of maybe creeping back in there. But they're blasting the movies again because they're glorifying smoking in the movies, and the kids are going to see the movies, and they're seeing the people smoke, and they're going, well, my hero does it, and I see these people doing it. Is that a problem for you, that it's being glorified again in the broad sense that, because people you're trying to reach live in a media world, a social media world, where I went to the store today, I got a flat tire today, my job sucks today. Everything is reported into the media. How do you approach that?
I mean, again, our advocacy team does a great job in making sure that we do outreach and that we're educating our youth.
Are you on Facebook?
Absolutely. We have an American Heart Association Erie Division Facebook page, which we're huge into the social media, the
Twitter?
smartphones.
Twitter?
Absolutely.
Yeah.
We're out there. We've got some great
There's some
information.
great apps about being healthy. I know
We've got
that
them. We've got
my daughter and son-in-law, they have a bracelet that they wear that somehow is tied into their phone, and it measures their everything.
Yep.
And I'm going,
Isn't it a wonderful world we live in now?
That's
so
incredible.
great tools to help people identify their risk. But certainly, I'm proud to say the Heart Association's really on top of the social media, certainly the outreach with our children, incentives, and scare tactics like our Hearts Attack commercials. Powerful ways to get the message across.
I watched that. That caught my
Wasn't
eye
that great?
immediately, and I'm going, whoa, this is extremely eye-catching, eye-appealing. Yes, would you just sit there while somebody's dying and do nothing and look? Yeah, you certainly have your challenges in front of you. Many of the organizations we have on here have a national spokesperson, or they have a huge fundraising event on television, telethons. Does the American Heart Association approach it that way? Do they have spokespeople, or they have a telethon that would air locally at all? Is that on the radar?
We don't really do telethons. Of course, we work with national spokespersons. Over the years. We've aligned ourselves with certain celebrities that fit our criteria. One thing I'm proud about with our organization is we're very picky about who we choose to align with, because we're really big into protecting the brand and the image, and I think that's fantastic. Locally, we really focus more on the feet on the street, our grassroots efforts, our Heart Walk, Heart Ball, Go Red for Women. Those are really important initiatives. And then working with our senior level executives, our decision makers in the community. They're the ones that can really help make an impact and a change, and implement certain policies at their companies that help us reach our goals.
Those policies have been implemented at the government level with, you can't smoke here.
Right.
You can't smoke. If you want to work for us, you can't smoke, period.
Sure.
How do people react to that? You have no right to tell me what I can do in my private life. Okay, I'm going to drop that hot potato right there. What do you think?
I mean, over the years I've seen certainly get some pushback, but at the end of the day, I think people really do care about each other. And I think that if we take that angle as leaders in the community and say, I care about my employees, I care about my family, I care about my children, I care about my friends, I think that people then start to get the message. It's not so much you can't do this, you can't do that. I care about you, and here's why we have these important policies in place. I think that we're trending definitely towards people being more accepting of that. Not that we don't sometimes have the pushback. You're always going to have that.
Right.
But for now, I would say that if we take the approach that it's more of a caring reason, and that the reasons we want that is because we want people to live longer, healthier lives.
Longer, because we all pay for it in the end.
That's right.
Big payments, in fact. Got about a minute left. Give them your best elevator speech here.
Great. Well, the American Heart Association is passionate about fighting heart disease and stroke. We really need volunteers. We need people to get more involved in our programs, our initiatives, and we certainly need people to support our fundraising efforts. If they're interested, they only need to call our office at 836-0013. I'm happy to come out and meet with them. We can implement some education and certainly help them live healthier lives as well.
Great. Gina Clough, thank you so much.
Thank you.
Appreciate it.
It's a pleasure.
Thank you so much for being with us. I'm Phil Fatika. Until next time, take care of your heart. Bye-bye.